telling us that she had a little bit of a problem with headaches. And Mandy, when you have a headache, where do you feel that pain usually? Like up around the temples or up in the front? Kind of in the temples, and then does it run back and around at all? Sometimes? Okay. The reason I asked her where she feels pain is I'm usually trying to find a pattern. That pattern that she described is most often, in my experience, from the sternocleidomastoid. It's very interesting because these guys are in the front of the neck, so it runs from the sternum to the mastoid process, sternocleidomastoid. This is a landmark because you don't typically want to go in front of that muscle into the neck and throat. But if I trace the muscle down, you have one on either side. If Mandy turns her head to the left, so turn your head to the left for me. There we go. You'll see that this guy shortens, so it lifts up so you can see it. If I give her a little resistance, press your head into my hand, Mandy. You'll see it pop up right there, and then turn your head to the opposite side. Same thing happens on the opposite side, okay? So if she turns her head to the right, the left side shortens. Now bring your head to center and lift your head gently. So tuck your chin and lift, like you did in a sit-up. And then what happens is both sides contract. Now relax it down. It was just a quick demonstration of the movement of that specific muscle. When people are having problems, I'm going to bring them to neutral, and I'm actually going to support her head here. So this allows me to give a little bit of movement through here so that I can grab onto the SCM. I'm literally pinching comfortably between my pointer finger and thumb pad, right in there. Now, sometimes I will feel the muscle slide back towards the neck and away from my fingers. I'm trying to put pressure directly into the muscle to a degree that Mandy can relax and release. What I'm trying to find is if that pain pattern repeats itself from work on this muscle. I could be completely wrong. There are other muscles that refer pain into the head. We're just going to check a few to see if we can figure out what may be going on and see if part of Mandy's headaches might be soft tissue related. Get a good grip right there. When you have headaches, Mandy, do you feel them more on one side or the other? Okay. Are you feeling anything in your head from that? A little bit? Is it just on this right side? Yeah. Does it feel familiar? Yeah. When I ask if it feels familiar, all I'm trying to do is find out if this muscle could be one that's causing her a little bit of problem. And if this guy is, from a scientific perspective, if nerves are somehow being innervated by soft tissue, we release the soft tissue, the nerve is no longer being innervated. It's no longer transmitting a signal of pain, which she interprets as a headache. And we're going to see. Usually as I go up towards the mastoid process, this tends to become a bit more tender. How's that in there, Mandy? Do you still feel that referred pain up and around? Not as much? Okay. She wasn't feeling it quite as much, just feeling my way around. I let go of attachment to particular outcomes. I'm just working with Mandy and helping her explore right into there. How's that? Little referred pain? Yeah. And does it feel familiar again? Yeah. Holding on here, I've got options. I can pull down towards the feet, or I can pull up towards the head, and I'm going to give Mandy a choice. Which of those do you like better? Towards the feet or towards the head? Towards the feet. Okay. There we go. I can move just a little higher, right into there. A little more intense, Mandy. Okay. She said it was just a little bit more. Going slow. These attachments usually seem to be the problem area. I don't find it as much down towards the sternum. I'm still far enough away from the attachment at the mastoid process that I can get a grip here. If I moved any higher, I couldn't hold that grip, but what I will do is, since I'm grabbing around the muscle, I followed it up. I'm going to try to find that with my thumb, and I'm going to place a little pressure right in there. Referred pain from that, Mandy? Feels familiar? Yeah. I'm going slow. You'll notice that we've only worked the sternocleidomastoid, the SCM for short, on one side. Just got a little thumb pressure right there. I'm going to hold her hand. Started to say hand. Hand and head. What's a combination of the two? I tried to make that word up. It sounded smart. Then I'm going to work the opposite side. I want to see if there's any difference with this side. I'm going to start about halfway up on this. Right in there. Any different than the other side, Mandy? Same. These muscles, if you'll remember, when we had Mandy shorten both to lift her head forward, people are doing that all day long when they're at a computer, when they're driving. It leads to this forward head posture because these muscles are both shortening. Many people are getting a compression in the posterior of their head and neck because of it. And I'm usually trying to help them bring awareness to the fact that they need to strengthen the posterior muscles and tuck the chin to bring it back. Right along the SCM. Grabbing that guy comfortably. It's a gentle squeeze. You don't have to use a lot of pressure here. If I use too much pressure, she will contract, she will protect, and almost nothing will let go. She'll release and unwind. Creates a sense of safety and protection. And then following that guy up on the left side, just like we did on the right towards the mastoid process. A little pressure. How about there? Just tender? Okay, is that better there? There we go. And mobilize the head and neck while I press. And hold. Of all that we just did, you felt the most over here, most referred pain. I'm asking for feedback because we're trying to narrow down what to focus on. She was having more issues on this right side, so I'm going to go back in and grab that guy. Provide just a little more, just to see how much of a response we get. You still prefer the pressure down towards the feet? There we go. Tractioning down and away. I was pulling on the muscle, then pushing back and forth several times. Right through there. It feels ropey and dense towards the center to me. Usually when I feel tension in a muscle, there's a strong correlation to someone feeling discomfort or pain associated with that muscle as well. I find where to work by using touch, by palpating, finding that tension, and then slowly allowing it to release. Big, broad thumb, broad side of my index finger, grabbing and pulling down towards her feet. Going to give her some length on both sides just to mobilize the neck. And I want to see what role her temporalis may be playing in the problem she's having. I'm going to put my left hand over her ear, roll her to the side. The temporalis goes around the temporal bone, right around here. And the temporalis muscle attaches and goes down under the zygomatic arch onto the mandible. It's a muscle of mastication, muscle of chewing. So it winds up contracting this way to chew, as we chew on food. Causes a lot of people headaches and issues. I'm going to slowly, using broad, flat fingers, work up and around this just to see what Mandy reports. Feeling for the muscle pulled along the skull to feel how much, if any, tension is there. People with TMJ dysfunction, cases of bruxism where they grind their teeth, head and jaw pain, are often having issues with the temporalis. Working over right through there. As I'm working through there, do you feel pain other than where I'm pressing, Mandy? Intense sensation?
Yeah.
And is it just where I'm pressing?
It's like around this area.
Yeah. So, Mandy was saying earlier that she was having headaches, sort of like around her temple. She pointed at an area that's very close by, but working on this muscle along with others means that she could be having a little bit of, nerve pain from sternocleidomastoid, a little bit of nerve pain from temporalis, and then in combination, if she gets little spasms in those muscles, she gets a headache. That is the closest to a scientific explanation that I currently have in my practice. I'm trying to look at research and pain science for more information, but my clinical experience leads me to believe that many people are having tension headaches. And if you remove the tension, the headache just goes away. The symptoms decrease. Usually when I work with someone, I want to decrease the frequency, the severity, or both when it comes to a condition. If they're having headaches, I want to decrease the frequency, I want to decrease the severity, and preferably both. I'm going to switch sides now. Same deal, opposite side, right along the temporalis. You can go with the fibers of the muscle, and you can go cross fiber. The easiest way to learn to give very good body work and massage is to trade it with people. If you trade with people consistently, that means that you are able to give and receive. If you really want to learn, you practice with someone. You give to them, they give to you, you give them good feedback, you keep working on it again and again. Right there, Mandy, how's that? Yeah, I felt this one specific line of tension right along here, and I was focusing on that. I've worked long enough that I can work with you, meaning the cameras are rolling and I can talk and I can feel at the same time. Right through there. I'm gonna hook and then lengthen and pull right there. Some increasing skin stretch right over that area, trying to draw Mandy's attention, her nervous system's attention right into that area. Right deep down in there. Hooking in again. Right there. Working on the scalp, huge surface area of skin. Mandy has long hair that I do, pulls on the scalp, pulls on tissue, pulls on nerves. Bringing her head back to center, I want to try working on both sides at the same time. That same traction and pull. I'm going to hook the fingers in. Traction up. This is a cephalid towards the head. I always remember this because Alexander the Great had a horse named Boecephalus. Boecephalus means ox head. Cephalus, head. Cephalid, towards the head in Greek. Right in there. So up towards the eyes, Mandy, or back towards the back of the head? She liked the pressure back towards the back of the head. I gave her a quick choice. By giving Mandy a choice, she feels more in control of the session. I communicate more verbally in my sessions than some people are familiar with when they think of just massage. But I believe I get better clinical outcomes, and there's a small component of trust that grows with the client when they know that they can help steer me towards what feels good, that I'm engaged that I'm listening, that I care about the issues that they're facing. When body workers are asked about the most effective way to deal with pain, many times they'll talk about technique. But research studies have apparently shown that the number one factor in whether a client actually improves is whether they feel they have a strong connection with the therapist. So that's what we focus on. You use good techniques, but if Mandy doesn't like me and doesn't think I can help her, frankly, she has a greater likelihood of not improving. And Mandy laughs. Right, a little more posterior, right there, Mandy, how's that? This is more specifically a sequence for headaches. I'm working through some muscles I think might be causing a challenge. I'm grabbing hold. Now again, back to the back. There we go. So I'm still was tractioning cephalid back towards the top of the head, the crown, but I was also now pushing down back towards the base of the skull. There's some pressure, but it's moderate. I'm then going to get to the ears, and I'm going to use the ears as a handle to gently traction and pull the skin around the scalp, around the ears, around the skull, in various directions. And I want to find out from Mandy which direction she likes best. Down through there. Now, a little more that way, towards the feet, or a little more that way. Right in there. Okay. I'm using the ears as a handle to traction and gently pull skin back towards the base of her skull. And I'm gently pulling, it's like I'm pulling the ears back and off. Really, you don't underestimate how relaxing this is to people. They're not used to people making contact with skin in this area and stretching it. But tons of nerves, right? When you do body work, primarily what the science seems to be explaining is we make contact with skin. And what connects with skin? Well, your entire nervous system, because those nerves go out to the skin and communicate what's going on. I'm going to change my grip. I'm actually going to put my fingers gently inside the ear, the thumbs, to get a little grip. How about there, Mandy? More that way, down towards the feet. More that way. More towards the feet. You tell me when. About there? There we go. Gentle and slow work. It gets to a point where when you study pain science, you start to wonder what you're actually doing. Because you begin to wonder, am I really working on muscles? Or am I working on skin, and the skin somehow has an effect on nerves, and the nerves affect muscles? There's a bit of, I think, philosophical complexity that we're still trying to figure out scientifically. But I'm very pro-science. I want to know. I want research so I can give Mandy a better session. It's always going to be an art, but when we increase the science, we increase specificity. And I think we get better clinical outcomes. I'm going to back off. I'm actually going to go towards the ear itself. meaning more the lobe, making sure not to grab hair. And I'm going to traction, out and away. I want to grab the skin around the base of the neck. I'm just pulling the hair up and out of the way. I'm actually going to hook the hand so that I can traction. If I want, I can use just the thumb and the pointer finger and this entire groove right there to hook in more towards the base of the skull. I can then overlap and traction both. How's that there, Mandy? If I change my hip position, it allows me to sit in a way that feels slightly more comfortable. I was sitting with a little bit of a slouch. And I can hold this for some time. I'm going to sit. I'm actually exploring my range of motion through my hips. I'm going to use it as an excuse to rock back and forth. So that I can come in and traction, lengthen the cervical spine. I can always switch hands any way I want. I can use more of the broad fingers. Again, mainly making contact with skin, tractioning. Which direction feels best to you, Mandy? To the left, to the right, or back to center? To the left. And is that too far over? Okay. So now that we've got her over to the left, I'm going to switch my hands. I'm just trying to make myself as comfortable as possible. How's that there? And that feels good to me, so I'm going to hang out there for a second. A little more twist, good. Back at this left-sided bit of traction. I'm hooking my hand around the skin of Mandy's neck and just tractioning, lengthening and stretching. Just mobilizing my hips so I can move around, stretch and lengthen, make myself feel more comfortable. I'm going to, on this left side, I'm going to use the finger, my middle finger. I'm going to hook right at the base of the skull and see how that traction feels to Mandy. Good there. I can slide the finger back this way. I can shear side to side. Which one feels better? 1 or 2? 2 felt better. Now, I've got that finger, that middle finger right at that edge. I'm going to reach the hand under and support that finger because I don't want it to work hard. I don't want it to shake. I'm going to see if I can support it just right. Using the body in a way that works with its own ergonomics. The body's designed to work a certain way, and I want to take advantage of that fact. I'm using Mandy's weight of her head to just push down into my fingers. And then instead of just grabbing with the left hand, I'm allowing the gravity to pull her into my hand and then reinforce with the right fingers. It feels balanced, supported, soft. When it feels relaxing and soothing to me, it feels more relaxing and soothing to the receiver. if I'm straining, subtly she's going to pick up on that, and you don't want to strain. Right there. So, 1 or 2. She wants a little more pressure right to the posterior, pulling back towards the suboccipitals, using the right fingers to reinforce there. If people are having headaches, I recommend that you check the sternocleidomastoid and that you check temporalis to see if they're feeding into the tension that people feel for headaches. How was that, Mandy? Good. I'm glad you feel better. Thank you so much for tuning in with us today here at Psychetruth.